podcast channel Pharmacy International. It's me Natasha, and topic of today's video is IPG, that is International Pharmacy Bridging Program. It is one of the program which is required by most of the provinces in order to become pharmacist in Canada, and it's mandatory for some of the provinces. Let's say for Alberta and British Columbia, it's a mandatory requirement. When it comes to Ontario, if you are able to do your qualifying examination, that is MCQ as well as OSCE in your first attempt, then you can skip the IPG for Ontario. Let's talk about British Columbia. So in British Columbia, it's a 6-month duration program. When it comes to Alberta, it's almost 10-month duration program. For the complete list, or you can say the up-to-date information, I would say just go to their official website. You will come to know if there is any recent updates on this. As I told you in my previous videos that I have done IPG because I couldn't do my qualifying examination in first attempt. So I will let you know more about IPG for Ontario. So in Ontario, the IPG is conducted by University of Toronto, and it's 23 weeks complete online program, and there are two parts, let's say CPS 1 as well as CPS 2. So the best part for this program is that it is online, so you really don't need to go to the University of Toronto. You can do this program anywhere. And CPS 1 and CPS 2, they both have 4 subjects, let's say pharmacotherapy, clinical skills in management, professional laboratory, as well as one of the programs which is related to your skills and foundation of pharmacy practice. As I told you, there are 4 subjects in IPG. So let's say first one is PCT, that is pharmacotherapy. So in pharmacotherapy, basically the IPG gonna cover some of the basic diseases, or I would say minor ailments. So that's the main subject related to pharmacotherapy. Then there is another subject that is CSMM, that is clinical skills in medical management. So the name indicates clinical skills. So in this particular subject, they will teach you how to put your skills in order to do the management in pharmacy practice. Third subject is FPP, that is Foundation in Pharmacy Practice. So these subjects help you to understand about the foundation in pharmacy practice. And as it is IPG for Ontario, so FPP gonna focus on the laws and regulation related to Ontario pharmacies. Last but not the least is PPL, that is Professional Practice Laboratory. So this particular subjects help you to understand about the software which is used in day-to-day practice in pharmacies. So both CPS 1 and CPS 2, they are 2 different semesters. So in order to appear in CPS 2, obviously you have to pass CPS 1 first. And the duration of the courses is, as I told you, it's 23 weeks. So it's almost 12 weeks program. And the main thing is, if you couldn't do any of the subjects, if you couldn't pass in any of the subjects in CPS 1, you couldn't appear in CPS 2. So you have to do all 4 parts complete in order to go to the CPS 2. When it comes to fees for IPG program, so it's almost 15,000 Canadian dollar for CPS 1 plus CPS 2. So it's almost 7,000 Canadian dollar for each CPS 1 and CPS 2. As this is IPG, means International Pharmacy Bridging Program, so this program is basically for the international students. So it's not for the Canadian students or the people who have done their degree in Canada. So this program is not for those people. So this program is not funded by the Ontario government. But yes, there are some bursaries like Ontario Bridging Program bursary, so you can get that bursary as well. The amount of bursary can go up to 5,000 Canadian dollars, but it depends how many people are applying for the bursary, how you are doing in terms of your job. Let's say you are doing part-time job, or you are doing full-time job, or you are doing nothing. So it depends on many factors. They're going to ask you to fill one particular form, and you have to fill that form, you have to submit some documents, and after certain time you will get the notification that how much bursary you can get for your IPG program. One major question some people ask me, that is it really necessary to do IPG? Is the IPG gonna help in qualifying exam, that's MCQ as well as OSCE? Because some people think that they're gonna do their qualifying examination and they're gonna go to some other provinces, they're gonna get license from that province, and then they come back to Ontario. They can change or transfer their license. So I would say, according to me, IPG is good. It really helped me, and obviously, as I told you in my previous videos as well, so some of the guidelines, specifically the guidelines related to hypertension, guidelines related to diabetes, so there are updates on these guidelines. So when I was doing IPG, it really helped me to clear my MCQ examination. And yes, IPG gonna help you in the OSCE as well. So in short, or to summarize about IPG, I would say that it is an international pharmacy graduate program. It's a bridging program though. So if you could do your examination, specifically the qualifying examination in first attempt, that is qualifying examination MCQ as well as OSCE, so you can skip that IPG in Ontario, and that's going to save some money as well as time. If if you have any question regarding IPG, I would say just comment in the comment section box. I'll try to reply as soon as possible. Thank you for watching this video. Have a great day.